The topic I chose for my presentation is NyQuil cold and flu. The type of medication function of NyQuil. This variant of NyQuil is a medication that contains acetaminophen, which is a pain reliever, dextromethorphan, a cough depressant, and doxylamine, a antihistamine, with its main purpose being used to treat symptoms of the cold and flu, such as fever, cough, runny nose, sneezing, and aches, such as headaches. There are the systems involved in general functions. There is a mix of the central nervous system and the digestive system that are at play with the use of NyQuil. The central nervous system is made up of the brain and spinal cord, which allows the body to coordinate body functions. Another system that is involved in the use of NyQuil is the digestive system, which functions to digest and absorb food that is then excreted through the digestive tract through the small and large intestine and rectum. The specific anatomies in sociology of the target organs such as of the medication. Although there is a combination of two systems that are affected by the use of NyQuil, the main target organ is the brain, more specifically the thalamus and cortex, with the liver being the organ that receives and metabolizes it. The thalamus is located superior to the spinal cord and it relays information from the rest of the body directly to the cerebral cortex, an organ that has a role in consciousness. The liver is located on the abdominal cavity. Sorry. Its general function is to regulate chemical levels in blood and excretes bile, which is a major fluid in the digestive tract. Okay. Micromedication mechanisms of action and the effects on the target organs. Considering that NyQuil contains acetaminophen, dextromethorphan, and doxylamine, there are a few mechanisms at play. You start off first with acetaminophen. It blocks off enzyme production in the thalamus and cortex, which in return blocks any further pain nerve impulses. And these pain nerve impulses are, you know, like receiving pain, like getting a paper cut or burning or touching something hot on the tip of your finger. Dextromethorphan affects the coughing reflex in the brain that triggers it, acting as a suppressant, and also reduces the effects of natural chemical histamine in the body, which sustains the body further. Mm. Lastly, doxylamine reduces nausea and vomiting by holding back histaminergic signals towards the medulla. How NyQuil is metabolized by the body. NyQuil is metabolized by the liver, and due to this, there is a risk of liver damage that may occur if NyQuil is abused and may lead to a loss of consciousness in the cerebral cortex. The half-life time of acetaminophen is around 2 to 3 hours, but with the use of NyQuil, its half-life time is doubled to 4 to 6 hours after consumption. And you will see that NyQuil doubles the half-life time of the rest, such as dextromethorphan, which has a half which has a normal half-life time of 3 to 6 hours, And with the use of NyQuil, it potentially stays in the body for 6 to 12 hours. Doxylamine, on the other hand, has a half-life of 3 to 6 hours. It potentially stays in the body for 6 to 12 hours. So yeah, NyQuil pretty much doubles the half-life time of those three factors. Now to the last slide of my presentation, the potential side effects of NyQuil. When using NyQuil for the first time, it might take some time to get used to the medication. And these side effects usually happen to any first time users of NyQuil. Um, this may lead to side effects that include sleepiness, dizziness, and a dry mouth, blurry vision, and urination problems. However, there may be more serious side effects that occur with its use that include allergic reactions, serious skin reaction, liver damage, excessive sleepiness or dizziness, and serotonin syndrome, which serotonin syndrome could be linked to like not hyperventilation, but like an increase of blood rate, increase like like an increase in the cardiovascular system, like faster heartbeats and all that. And these are my references. And now that'll be it for my presentation. Thank you for watching. And please be sure to give feedback or a question if you're still interested, because I can go into more further detail if you want. Thank you.